October is Breast Cancer Awareness Month, so this is going to be a very interesting and also important topic that we're going to talk about next. My next guest is Dr. Lora Hebert, and she is a surgeon, and also that's with Prevail Breast Center. And welcome to the show. It's very interesting of what you do. It's unfortunate that this is obviously prevalent, and obviously there's not much we can do. But welcome to the show.
Thank
and
you.
Please tell everybody a little bit about yourself and what you do.
So I am a fellowship-trained breast surgeon, which means that I have advanced training in just breast cancer. And I see a variety of patients with benign conditions or lumps and nipple discharge, pain, and whatnot. But then also have advanced training and a lot of experience taking care of women with breast cancer.
Now, you said that you operate throughout the East Valley and also Scottsdale, but your offices are in Chandler. And before you came on, we were talking a little bit about how people hear about you and if they can just call you. And I wanted you to talk a little bit about that, because it's not always that you have to be referred.
Right. A lot of women just call out of the blue. A lot of women find through word of mouth. A lot of women find us on the internet. Generally, the way that people get to my office, though, is either by a referral from their primary care physician after they've had some concern, either family history, high risk status, they may feel a lump, they may have an abnormal mammogram, and then the first point of entry really is a surgeon.
Yeah, and now she's located in Chandler, and her phone number is area code 480-275-2220. PrevailBreastCenter.com, and that's PREVAIL breastcenter.com. Okay, I want to talk about this because I said it was very important, and it is important. There's a difference between a breast surgeon and a plastic surgeon that
Yes.
does work on the same area.
Yes.
How's that?
So a breast surgeon concerns himself mostly with the disease of the breast and breast cancer, whereas a plastic surgeon would do the reconstruction after, for instance, a mastectomy or something of that nature.
So they come into you, and this is one thing I asked you also before, and you answered it right away. So I would like you to also talk about that, because it's important for them to know that if someone was to come to you and they did have to have a mastectomy or whatever, then what happens? Then you work with a different surgeon?
Yes, there's numerous surgeons throughout the valley in Scottsdale and Phoenix that I partner with, and we consult. The patient generally consults with me and then consults with the plastic surgeon, and we develop a surgical plan. And many times, I guess I should back up and say, thankfully, most women don't have to have mastectomies. We're very good these days at either shrinking cancers or being successful at doing lumpectomies, which is just removing a small part of the breast as opposed to a mastectomy. But absolutely, there's some women who either choose that option or who need a mastectomy, and then we would develop a surgical plan with the plastic surgeon beforehand. Generally, the removal of the breast and then the reconstruction can almost always be done at the same time.
Now, what is your philosophy in how you treat women with breast cancer?
Well, when I started Prevail Breast Center, it was really important for women to have this experience through breast cancer, even an abnormal mammogram, be as easy and as comfortable as possible, because it's so stress and anxiety provoking. So even, for instance, of calling the office and being able to talk with a real person instead of having to leave a message or talking to an automated voice, we've made that a real priority in the office to really have an intimate setting where women feel comfortable from the beginning. And then I think as a surgeon, I try to focus also on listening to individual patients, so listening to what their goals are, what their specific fears might be, and then looking at all of the potential options and coming up with a plan that works best for that person. So an example would be some women say, I absolutely don't want a mastectomy if I don't have to, and someone may say, I really want a mastectomy. So it's just trying to tailor the treatment to whatever a woman specifically would like.
Sure. Now, when someone finds out something like this, you said, do you come up with a treatment plan as well with them? So this is not just that you do the surgery, but you also, do you bring them down to how we're gonna get this, because it's cutting out what we don't want there, but it's also, do they need to have chemotherapy or radiation, and do you do that with them as well?
Well, I did, what differentiates me from other surgeons who might be in the Valley is my fellowship training, which basically is advanced exposure to chemotherapy, radiation, all of the other therapies that women might need. So that enables me then to talk with women up front about how all of those treatments might impact their decision making for a surgical perspective. And I consider myself kind of the first point of entry, and then also make sure that they get to the right specialist, the oncologist, the radiation oncologist, the plastic surgeon. So, and then remember, depending on the different types of breast cancer, some breast cancers might not need chemotherapy, some breast cancers might not need radiation. So it's a long discussion depending on the type of cancer, and then what surgical options they choose, what therapies they might need.
Do you feel that for anyone that might be listening to right now that might have been told that they have cancer of some sort of breast cancer, that they should have a second opinion?
Well, I personally never, I always encourage my patients to seek a second opinion. I think any doctor who finds that offensive, I would be wary of, even if it's just to confirm what you have said. And so if a woman wants that, I absolutely recommend that she do that, and I would be wary of doctors who found that offensive.
She operates throughout the East Valley and Scottsdale, but her office is in Chandler. Her phone number is area code 480-275-2220, and the website is Prevail, Prevail, Breast Center, and that's spelled out, .com. And if you want to also look her up, and I'm going to say this because of what you do, that you might want to even Google her, I'm sure, and find out some information. Can they find that on, because everybody wants to know the info on the doc.
We've tried to make the website really informative as well, so there is quite a bit
So it should be there? Okay,
quite a
so
bit of information
and
about.
that's, but let me spell it out for you. So it's Dr. Lora, Lora, and then it's Hebert, and then of course you can go on the website, which is prevailbreastcenter.com. What are some of the risks factors, for getting breast cancer?
Well, certainly there's genetic factors, as we've all heard about in the news in the past year or so about Angelina Jolie, although the BRCA mutation, which I understand she had, is actually quite rare. We do that testing out of my office, but again, it's really quite rare. And then all of the other risk factors are mostly what I would say are estrogen mediated, so you could start as basic as saying it's a risk factor to be a woman, right? There are men that get breast cancer, although very, very rarely. But a lot of estrogen-mediated factors. So, for instance, the number of children you have, the more children is more protective. The earlier you start having children is protective. The later your menopause is protective. We're learning, of course, now about the increased risk with hormone replacement therapy in a postmenopausal status. And then other things like obesity, which has become so prevalent in the United States, especially postmenopausal obesity, definitely increase your risk for breast cancer.
And it also, unfortunately, could be the luck of the draw. Some people don't have any of it running in their family, and somehow or another, and they can be very healthy, and they come down with this. I mean, somehow. I don't know why these things happen. Now, we're going to go to a break, and when we come back, I want to talk further about this. It's important. It is Breast Cancer Awareness Month. October is. Most people are, aware of that right now. Maybe you know someone who's dealing with something like this, or maybe you are. You can go on our website, which is Prevail, Prevail, Breast Center, that's all spelled out, .com. Her phone number is area code 480-275-2222. She operates throughout the East Valley and Scottsdale, and her office in Chandler. Hang tight, guys. We'll be back in just a minute.